academic credentials including PhD from Pondicherry Central University with the topic Development of Zirconia and Transition Metal-Based Magnetic Ceramic Composite and its structural investigation at elevated temperatures. She had published more than 9 papers in reputed international journals. She worked as a senior project associate in collaboration with the Process Engineering Division Council of Scientific and Industrial Research Central Electrochemical Research Institute, India. She has supervised 7 plus PhD graduates and 12 plus master's graduates. She had the chance to collaborate with several departments like the School of Life Science, Pondicherry University, Materials and Metallurgical Engineering, IIT Varanasi, and a few others. She has worked on metals, ceramics, and polymers for both implants, jet delivery devices, and hyperthermia applications. This shows her continuous pursuit of knowledge and excellence. I extend my warm welcome to you, ma'am. I extend my heartfelt greetings to our principal, Dr. Sujay Siddhi, who always support and encourage us in all our endeavor. I would like to express my deep sense of gratitude for the unstinting support and guidance offered by our principal. Welcome, sir. I also welcome the IQC coordinator, Srimati Chandani PM, the webinar coordinator, Dr. Bhavya B., Chair of this session, Dr. S.D. Sachi, Head and Associate Professor, Department of Physics, Dr. Anushree V.K., Assistant Professor, Department of Physics, and also the staff members, students, as well as all participants from other institutions to today's technical session. I welcome one and all. Now I welcome the most encouraging and empathetic Dr. S.D. Sachi, Head and Associate Professor, to chair today's session. Over to you, sir.
I think I am audible. Grand welcome to all the participants, especially Dr. Subina Raveendran, our chief guest and presenter of today's program. Today's topic typically is about biomedical implant materials. Typically speaking, we are all heard of these biomedical implants, starting from cochlear implants, pacemakers, heart valves, stents, everything. So the story never ends there. The technology has gone much forward. Today, even unknowingly, we are taking many implants. Even the tablets, which what are called sustained releasing mechanism, tablets with sustained releasing medicine releasing mechanisms, are also forming part of even treatments. And unknowingly, we are forming part of these developments. Now, from time immemorial, human beings were interested in implants. Maybe the first implant would have been teeth. In all old civilizations, people would have tried with many crude mechanisms to implant in the place of teeth. Transplants and implants are, of course, quite different. Transplants comes largely from our own body or from somebody else's body, like that. Where implants are foreign bodies, and our body do have that tendency to reject foreign bodies. So, how to overcome this was a problem from the very beginning. Now, sustainable mechanisms or biocompatible materials, the development of such materials would have been a problem from the very beginning, and with the attempts with the titanium or zirconium based materials, as well as later it went on to many advanced ceramic materials, and now it almost reached the polymers. Polymers are the latest developments, I think. So a lot many materials have been developed, and I think our speaker, Dr. Subina, who is quite experienced in this field, will be able to send or take us with the latest developments in this field. And without wasting time, I am inviting Dr. Subina to take the session. Thank you.
Thank you, sir. Thank you for the brief introduction, and I'm thanking Dr. Winnie for the warm welcome. Let me just get started with the presentation. Let me know if I'm audible and if the PPT mode is on.
Yes, yes, you are audible, and the PPT is visible. Okay, can
Okay,
proceed.
okay. Yeah, thank you. So, today, good morning to one and all, and today I'll be talking about development of biomedical implant materials, and these are the contents of my presentation. Before jumping into biomaterials, I would like to talk on basis on research methodology. That is how to start with introduction of biomaterials, its importance, different synthesis methods, and what are all the things has to be considered while designing an implant, and advancement and future trends. And finally, I'll conclude with one of my works on development of multifunctional biomaterials for bone implant and hypothermia therapy. So let me just get started with the research methodology. So if you are planning to do research on any field, let it be biomaterials, let it be semiconductor materials, or let it be materials for aerospace application, whatever, you should have to follow a systematic approach to get be successful. So, in order to do a research, the first and foremost thing is to define a research objective. So, here what comes as the give me a second. Yeah. So here what comes as the uh, your idea. If you would like to synthesize a new material, or if you want to study a property of different properties of existing material, or if you want to develop a new application for already existing material. So then comes the background research, which is called a literature survey. Say, for example, if you have pain in your left eyes or left ears, what would you do first? You basically search Google, and the Google will tell you what n number of results, and we will not just stop with the first article or link which will comes. We will basically do check 5 to 6 links which and match your symptoms, and then try to predict which one meets your guesses. So basically here are we are searching here on Google Scholar, and I would, if you are new to a field, I would always recommend you to do search on review articles. We have review articles, we have research articles. Before jumping into research article, it is always recommended to do a study on review articles where you will understand what all are the already existing works, what are all the currently doing works, and what are all the gaps which need to be filled. So from the gaps, you can, sorry, so from the gaps, you can formulate your hypothesis. This is your research question. So basically what you do is a formulating a research hypothesis, and then it's like you are raising many questions, and you it should be focused aligned with your research objective. So then comes the design of your experiment. Here, you are planning and designing a particular experiment which involves, for say, determining the parameter which need to be monitored or controlled, and or any conditions which need to be given or controlled, or if what it is like, what all what synthesis material, what synthetic approach you are utilizing for your particular experiment. It's like you have plenty of synthesis methods, and out of that, we have advantages as well as disadvantages. And if the disadvantage doesn't affect your outcome, you can always go for that. So, this comes the experimental design, then comes the data collection. You do, after synthesizing your material, you do collect different data from analytical methods, and you can draw your conclusions, and you can interpret your data, relate them with your hypothesis or your research questions. If it is matching, sorry, it is matching, you're good. If not, you have to revisit your hypothesis, or you have to rethink about your synthesis method, or you have to refine your research direction, and so on. So basically, this loop goes on. It's not a direct loop. This loop goes on, and it's very normal. And if you're good, and if your research or if your data is matching with your hypothesis, then you highlight the significance of your work, and you can highlight the limitation of your work, and then you can also say the potential future prospects of your work. So that's it. When you're done, you can communicate your work to relevant journals. That's it. So that's it. The brief thing about how research has been carried out in any field. So let me jump to biomaterials. So what is a biomaterial? So biomaterials basically have many definitions. So here uh, it is a synthetic or natural material which is used to replace a diseased or damaged part of your living system, which will be in intimate contact with your living tissue. So basically, if you have a problem with your joint or wherever, you are replacing it and implanting either natural or a synthetic material to your body. So then the question is why it is important. So we have to restore and enhance bodily function. As Dr. Sanjay said, we had pacemaker, which helped the cardiac patients to perform their bodily functions normally, and it obviously treat chronic conditions, and it helps in improving the patient's safety. And usually in previous times it was like you have to perform multiple surgery to make sure that your implant is working. So now the research and technology has really improved. You don't need a different surgery, n number of surgery to test your material is working or not. And obviously it is important in advancing the medical research and innovation. Sorry. So then comes to the types of biomedical implants. That is, we have cardiovascular implants, which are pacemakers, stents, artificial heart valves; neurological implants, which are deep brain simulators; cochlear implants for ears; and orthopedic implants, which are spinal implants, joint or bone implants; dental implants, which are your dental braces, artificial tooth, and screws. Here I would be focusing on, yeah, orthopedic implants. So while considering an implant, what would be the optimal implant properties? So it should have a good tissue response, because you are creating a new, synthesizing a new material, and you're placing it in your body. The host, should accept the guest, that is your implant. So you should consider the biology, that is the tissue response, and hence we are dealing with bone implant material. You should also consider the strength, because it needs to be resistant to stress, motion, I mean transfer and all. And one more thing is, you are implanting your material to a different kind of body fluids, which are body fluid which are tend to be acidic or alkaline. So the material should not react to that particular kind of environment. So it should be corrosion resistance. Okay. So these are all the types of biomaterials: metals, polymers, and ceramics. So we have, each of them have their own advantages and disadvantages. So, but there are always options to tackle the disadvantages by compositing it or coating it or whatever. So coming to metals, as we know, we have it have high strength, high ductility, wear resistance, arrow, and all. And unfortunately, it tends less biocompatible, and it is more prone to corrosion because of ion leaching. As I said earlier, you're implanting a metal to your body, and the body fluid, it will come in contact with your body fluid, and which is acidic in nature. So it can leach your metals, and by leaching, the ions will interact with your body fluid, and which can infect your cells. So always there is a solution. So here people are using ceramic coatings or polymer coating in order to tackle this one. So coming to polymers, sorry, we have, it's low density and it can be easily fabricated, but we have to compromise on the mechanical accept, and then come to ceramics, which is what we are going to discuss today. So they are good, they are highly biocompatible, they are corrosion resistance, and they are high compression resistance. Still they have limitation on brittleness and fracture strength. In case of production difficulties, nowadays we have almost overcome that challenge. So, if I take examples of ceramic materials, they are alumina, zirconia, titanium, and calcium-based implants, calcium phosphate-based implants, such as hydroxyapatite, beta tricalcium phosphate, and so on. So coming to ceramics, we have biodegradable, bioactive, and bioinert. As I said earlier, each of them had strength and disadvantages. We will be focusing on the bioinert materials, which possess high strength, ductility, and high wear resistance. And I'll be talking about the zirconium material which I have taken for my bone implant application. So we have different synthesis approach to make zirconium nanoparticles. Uh, I have listed only four. There are multiple numbers. I mean, based on what you need, you can choose any of them. So coming to the co-precipitation method, it is the simultaneous precipitation of more than one component. So basically, you take aqueous solution of different salt of desired precursor, obviously, and mix it together, and you will play with your pH in order to get different precipitate. And then comes to hydrothermal method. Here, the process is carried out in a sealed container, and we are exposing it to high pressure and high temperature, which will be in range of 100 degrees Celsius to 250 degrees Celsius. And then comes to ultra fast laser ablation technique. Here, basically, what we do is exposing a zirconium rod in isopropyl alcohol and exposing it to ultra fast laser ablation. And then comes the soap gel based method, which is my favorite, and it is simple. So here we use molecular precursors. Basically, the precursor are metal alkoxides, which are either dissolved in water or in alcohol. and we convert it into gel, that is solution to gel. That is why it's terminated soul gel. Sorry, it is termed as soul gel. So what we do is we convert this solution to gel by continuous heating and stirring, which results in hydrolysis, and finally we get a gel. This gel is dried, and then further it is heat treated to obtain powder sample. So I would say this is cost effective, and due to low reaction temperature, there is good control over chemical composition of products, and moreover, the obtained products are homogeneous in nature. So, and on top of that, we can also use these bioceramics for surface coating. As I mentioned earlier, for metal implants, these bioceramics, either the zirconia based or titanium dioxide based or whatever, you can use as a surface coating with use of different deposition methods such as physical vapor deposition, chemical vapor deposition, or just dip coating or electrophoretic deposition or whatever. And it can be used for several applications such as dental implants, artificial heart walls, sensors, skull plates, and so on. So, so what are the things to consider while developing a biomedical implant? The first and foremost is the biocompatibility. You are introducing a guest to the host body, and it should accept what you are giving. And then comes the longevity and durability. So, as I said earlier, you are implanting a material, and you should expect it to stay it for years. You should not want it to do a multiple surgery and replace each time like you're changing your batteries. So we need longevity and durability, and it should be infection free, and you should also consider the surgical techniques and procedure, which is not in our hand basically, and ethical consideration. This is the final stage when you really test your material with cell, then with tissues, and then with animals, and then finally with in human. So we have to have ethical consideration while performing a biocompatibility test. So so, coming to recent advancements and future trends. So, uh, in case of ceramic implants, we have already established different kind of 3D printing of implants, different bioactive coatings, nanotechnology for implants, and nanotechnology, I should say, different nano robots which can perform your surgery, or nano robots which will go and kill the cancer site, and regenerative medicine and tissue engineering. And we can also use it for not only for bone implant application, it can also be used for bone cancer therapy, which I was specialized in. So, so that was the brief introduction of biomaterials. Now I would like to take you through one of my research work, which is development of multifunctional bioceramic material for bone implant application hypothermia therapy. So I'll try to make it as simple as possible. So coming to bone cancer, which is also called osteosarcoma, which is basically cancer developed due to immature growth of immature cells. So we have already different therapeutic approach for bone cancer, that is chemotherapy, radiation therapy, and surgery. These are all the techniques which we are currently using, but it have major drawbacks such as severe pain, deep anxiety. Normal cell can also go vanished, and on top of that, the reoccurrence of cancer are highly possible. So here we focused on magnetic hypothermia therapy. Is a specific type of therapeutic approach where we place a magnetic composite at a tumor site, which will act as a thermal actuator. So basically, we this is a magnetic composite, and we are giving an alternating magnetic field. So if say, hope you have come across the term super paramagnetism, where if your nanoparticle is below 50 nanometer, and if you're giving an alternating magnetic field, it will create a dipole moment, spin dipole moment. So when you're giving an alternating magnetic field continuously, this dipole moment will result in a heat dissipation. So this heat, just dissipated heat, is transferred to the tumor cell. So as I said, cancer cells are immature and they are more sensitive to heat than our normal cells. So when you keep a magnetic composite, and you're applying an alternating magnetic field, it creates spin dipole moment, heat will be dissipated, and your cancer cells are killed. So coming to the composite which I have formulated is the combination of tetragonal zirconia and cobalt ferrite. So this is the schematic representation of the work. Basically, what we do as this is osteosarcoma cells. We are surgically removing it, which results uh, uh, a defective site with residual tumor. Still, the problem with the existing therapeutic technique is the residual tumor, and the residual tumor which can result in the recurrence of again growth. So here we are implanting our material, which is composed of a magnetic part and mechanical part. So, and we are exposing it to an alternating magnetic field, which will help to kill the residual tumor, and the mechanical part, which is zirconia, which will help in reinforcing the defective site. So let me explain about zirconia in detail. It's a polymorphic material which occurs in three different temperature, that is, three temperature dependent forms. They are monoclinic zirconia, tetragonal zirconia, and cubic zirconia. For biomedical implant application, we basically rely on tetragonal zirconia because of its exceptional mechanical strength, biocompatibility, and structural stability at elevated temperature. So, in order to, these are all the forms which are stable in these particular temperature. So, in order to stabilize high temperature tetragonal zirconia to room temperature, we use stabilizing agent such as magnesia, zeria, yttria, and calcia in order to stabilize zirconia, high temperature tetragonal zirconia to room temperature. Sorry. Then comes to cobalt ferrite. I have used because of its exceptional magnetic property, physical flexibility, mechanical compatibility, and resistance to corrosion. So, I have, as I mentioned earlier, I have implemented soul gel synthesis for obtaining combination based on zirconia, tetragonal zirconia, and cobalt ferrite. So I had to carry out different physico-chemical characterizations, different mechanical characterization, and different biocompatibility analysis in order to analyze if I got uh, decide combination, or if I have to play with any conditions, if I have to change with any parameters such as temperature, concentration, or whatsoever. So coming to the results, so this, in order to analyze the analyze what material you have obtained, we first rely on XRD. I think I hope everyone has come across the term XRD, X-ray diffraction analysis, where it is a non-destructive analysis where we can obtain the crystalline structure of the your material, and you can attain the what phase content each compound have, and you can also determine the crystalline size of your material, and so on. So here is my plot for the combinations which I have tried, and once you get an XRD plot, you basically match with the ICDD. ICDD is International Card for Diffraction Data. This is a standard card which is already available. When you have your material in your hand, you just take an XRD, which will give you a diffraction pattern. You match with the already existing ICDD pattern to see if you have obtained your desired phase. So here you could see I got tetragonal zirconia. This is my peak. I got a tetragonal zirconia along with monoclinic zirconia. You can see here, which is not my desired phase actually. So, and I could not find any cobalt ferrite here in these two diffraction pattern. So I have played with my concentration, and I have also played with temperature, and at particular concentration I could get the side tetragonal zirconia, and I could not find any monoclinic zirconia. Monoclinic zirconia is not really desired for biomedical implant application, so there is no monoclinic zirconia, only tetragonal zirconia, and I could find a phase, I mean, phase corresponding to cobalt ferrite. So I would say at this condition, I have obtained my desired composite. So this is the refined X-ray diffraction pattern. To put it in simpler terms, I should say refinement of X-ray pattern is that it's a quantitative. Oh, sorry. So refinement of X-ray data as quantitative analysis to understand how much phase content you have in your material. For say, if you eat a food, you need to understand the percentage of your carb or protein or whatever. Likewise, I got a material, I need to understand the phase content of my tetragonal zirconia phase and phase content of my cobalt ferrite phase. So in order to understand that, we do exclusive refinement studies to understand how much we have got, and it also says in what all concentrations you have got different phases, and it also gives you the crystalline phase. It also gives you the lattice parameters. So again, these are all the phase content which I observed. So you can see, when you see here, these are all my undesired phases. I could see monoclinic zirconia and all the other condition except these three. So I would take only these three as my desired condition to carry forward my research. Coming to X-ray photoelectron spectra, it basically works on photoelectric effect. The main purpose of taking an X-ray photoelectron spectra is to identify the valency of your element in that compound. For say, if you are taking iron oxide, which is Fe3O4, and Fe2O3, which has two different 3 plus oxidation state or 2 plus oxidation state. So if you get 3 plus oxidation state, it's hematite, it's non-magnetic, and you cannot use it. If it is 2 plus oxidation state, it can use for several drug delivery applications. So if you get an iron oxide, you should make sure that if it is Fe3 plus or Fe2 plus. So which XPS helps us, and also it also helps us to know what is bonded to what element is bonded to what. Yeah. And then comes to mechanical and morphological features. So, in order to get the morphological features, we take scanning electron microscopy. So, these are my SEM, that is scanning electron microscopy images. So, here I take my SEM images to make sure that my material have dense grain with pore-free structure, and you can find two distinct phases, that is cobalt ferrite here and tetragonal zirconia here. So I assured that it's a pore-free dense structure, and then I carry forward with my mechanical studies, that is nano indentation methods. Here basically what we do is to have a a diamond tip as embedded to your material. So your material, it's give a depth, and you analyze, you draw the hardness and Young's modulus of your material, and these are all the results which we got from different combinations, and this is a standard one for commercially available yttria stabilized zirconia. And if we match with this one, our combination have better Young's modulus and better hardness. So we are good to move forward with the magnetic characteristics. So here I got ferrimagnetic characteristics, and here we could see a trend that increasing. I have increased my cobalt concentration in my precursor. With increase in cobalt concentration, we are getting a hysteresis loop with high magnetization, and we are now I got good mechanical stability, good structural stability, good magnetic features. So hence it's a biomedical implant. We should make sure that it is biocompatible. So we have to do cell viability tests to make sure that when your material reacting with the cells won't die. So these are all the results. These are all the percentage. This is the standard, and standard just PBS solution, and standard we are matching. We have taken maximum of 1,000 micrograms per ml, and we can see here. We can see that almost all the cells are live. So we are good to go, and yeah, that's it. So this still have future uh, uh, works needs can be done in case of making a three-dimensional pattern and carrying out research in uh, further tissue level application. So that's it, which has been communicated in crystal growth and design. Yeah, so let me conclude with the take home message, that is, uh, if you do make a synthesis on biomaterials or semiconductor materials, that is energy materials or aeronautical materials for aeronautical applications or whatever, this is your base things. You have to have a question, search thoroughly, form a hypothesis, design a experiment set, and analyze your data, match with the literature, and then continue the loop if needed and communicate. Yeah, I think that's all from my side. Thank you all, and special thanks to Dr. Sanjeev, Head Department of Physics, and special thanks to Dr. Vinny, who have personally invited me for this sessions. And thank you all. If you have any queries, I'm open.
Thank you, Dr. Subina, for your nice presentation. Actually, Dr. Subina starts her research work from Pondicherry University, and she started her presentation with a slide on research methodology in science. And she explained the detailed steps involved in the methodology of science, and which is partly different from that of science or commerce like that. And I appreciate her step because it is not always available by means of literature or something like that. If we search for something research methodology in science, means it's not something easy to get. Now she proceeded with the classification of biomaterials, metals, ceramics, and different polymers, and she concentrated on her research work on ceramic materials, zirconium-based certain materials, and her typical research work on osteosarcoma or bone cancer treatment. And she developed some magnetic hyperthermal therapy for treatment of this osteosarcoma using zirconium-based compounds based on the fact that cancer cells or highly growing cells are more susceptible to heat radiations. Also, she mentioned the typical methodology, she mentioned the various scientific techniques, X-ray diffraction, PESCA or X-ray photospectroscopy, the scanning electron microscopy, hysteresis analysis, mechanical stability studies, and lastly and more importantly, the biocompatibility study. So it was a very nice presentation how a typical research work is carried out, every step involved and the pain involved in carrying out a research work. So, to conclude, I am leaving the space for clarifications, but to conclude, she has done an excellent job and she has made an excellent presentation here. And I hope many of these participants, many of our participants will be motivated to take up research works similar to this in future. Okay, thank you. Now it is time for clarifications. If any of the participants have any doubts, means they can clarify it with Dr. Subina. You can raise your hand so that your mic will be unmuted and you can clarify the doubts.
Ma'am, I'm Swaran Keke from third year BSc Physics. So ma'am, I have a doubt. During biomedical implantation, biocompatibility is important. So ma'am, any particular alloy is generally used for this biomedical implant in human body?
Sorry, what was your last statement? Any particular?
Any particular alloy is generally used for this biomedical implant in human body?
Alloys, right?
Yes ma'am.
We have different kind of material which are currently available for biomedical implant application. There are different. When previously we were using stainless steel based implant, and now also we are using titanium based implants. We you can also use alloys based on cobalt, chromium based, but these are all already have done. Now the recent trend, as Professor said, people have already stepped on polymers, which is a recent trend, and three-dimensional printing of ceramic, which are the current trends. Alloys which we have already used, such as cobalt, chromium alloys, which are already used. Now it's the era for polymers, I should say. I think I have cleared your query.
Thank you ma'am.
Yeah, thank you. I think I'm seeing
Hello,
two more people. Yeah, hi, Sri Lakshmi.
ma'am. When we talk about biomedical implant materials in many classifications, we have seen
Okay.
titanium and its components as example. The research work is focused on zirconia. Any particular or special property will zirconia exhibit?
Yeah, zirconia, as I said, it's highly bio biocompatible, and it have high strength, high mechanical features, and it is wear resistant. These are all the things which I prefer. That zircon, it is bioinert in nature though, but we have already an alternative to coat something over it to make it bioactive. So zirconia, it's not only in bone implant application, it is very widely used in dental implant application. I should say it is widely used in dental implant application than bone implant application because of its promising characteristics such as high strength and uh, bioavailable. Yeah,
Thank you, Miss.
yeah. Thank you.
Dr. Subina, can I ask you a question?
Yeah, sure, sure, sure.
While doing preparation, first you have started with the soldier, right?
Sorry,
So you
why?
started your
Why?
preparation with the soldier, right? Soldier
Yes,
method,
yeah,
then it
yeah,
converted into powder form.
yeah.
So in that conversion, which method you have used to hydrothermal or compression? Which method to convert soldier into powder?
I am not clear with your question. Let me just clear that if you are asking why I have
No, no,
chosen,
no. That is, you started with the soldier. You have the
yeah,
soldier with you. Then you
yeah,
convert that into the powder form.
yeah, yes.
Right? So by which method you have converted that hydrothermal method or compressing method? Which method you have used there?
It was citrate assisted soul gel combustion method.
Combustion. Okay. So at that
Yeah,
time,
it was
when
citrate
you heat
assisted
it,
soul gel combustion. Sorry.
okay. So that time, when you heat that material, it won't
Yeah.
get it properly.
So basically, I gave heat treatment at three different temperature. That is 900 degrees Celsius, 1100 degrees Celsius, and 1300 degrees Celsius. In among all those at 1300 degrees Celsius, I got my desired product. So it's just after drying, I'm treating it with different temperature, high temperatures, basically.
Okay, fine.
I
Thank you.
I hope I hope that was your question.
Okay, because I too did this whole job. That is why I asked how to convert the
Okay.
process.
Yeah, it was just through the hydrolysis process. I'm just giving continuous stirring and heating, and then you are getting a gel. Then you are drying,
Yeah.
and then you are giving the powder to further elevated temperature treatment.
Oh, okay,
Yeah,
fine.
yeah,
Hello, ma'am. Hello.
yeah. Hi, hi.
Hi. I am Veena. Ma'am, I have a doubt.
Okay.
How you incorporate magnetic hyperthermia in implantation? How you
Uh,
incorporate magnetic hyperthermia to your implantation work?
Yeah. So it's like if you have to have magnetic hyperthermia you have to if you have to use your implant material to magnetic hyperthermia application, you need a magnetically active material. That is, I have worked with different metal ferrite. I have only shown cobalt ferrite. So let's say cobalt ferrite I have included and it exhibited good magnetization feature, and we have tested this particles, I mean obtained particles in an equipment called nanotherix, which will give an alternating magnetic field and which will give a loop, which will give a curve, says that how much heat is dissipated with how much magnetization.
Hello, ma'am. It is hyperthermia. How magnetic helps in bone implantation or in the treatment?
Okay, so that's I think I would I don't know if my PPT is still there. Let me just go one second. Oh, sorry. Sorry, yeah. How magnetic hyperthermia helped in killing my cancer and bone implantation, right?
Killing
So,
the
so
cancer, I know. How
yeah.
it is used for bone implantation?
Yeah. That's why I think you're confused. So I have used two combination of tetragonal zirconia and magnetic ferrite. Magnetic ferrite is for just hypothermia application. So here's the zirconia part will not play in this alternating magnetic field. The zirconia part, the tetragonal zirconia part, it's a combination of both. The tetragonal zirconia will act as a bone implant. It's a combination of two. Tetragonal zirconia only will act as a bone implant. Obviously, this metal ferrite is ceramic, which will be in combination with the tetragonal zirconia. So, magnetic ferrites are separate and zirconia is separate. Hence, zirconia is mechanically stable. I have chosen that, and this one is magnetically active. I have chosen this, and I have made a combination of these two, and these two have two different applications. I hope you are clear.
Oh, okay, yes, ma'am. Yes, ma'am. Okay,
Okay,
thank
thank
you.
you.
Okay, anybody else is having some clarifications? Okay, I think it's almost over. Now a general question. As a scientist, how you are enjoying life? Is it advisable to my bright students to take up a career, career of a scientist? Is it advisable, or it is full
Uh,
of hardships? General question.
yeah, I should say that if you want a PhD title, don't do research just for a title. If you would like to do new things daily, you can obviously opt for research. As I said earlier, we all do research daily. If you have any pain on any place, you will go search Google and see what. We are all doing research daily. So if I say you are just dealing equipment, or you are just doing something, if your work is just doing the same work every day, for me it's a kind of boring. I can do it for 2 months, probably a year. But research is like each day will give you different task. It might be challenging, but after sorting out it, and when you come out you feel satisfied. And on top of that, if you get the result or not, you are daily updated. You are reading daily, you are daily updated, and you cannot it's like you cannot just sleep without just reading one sentence. That's the way I am enjoying science. It's not just biomaterials. I love reading history, I love reading politics or whatever. So it's like everyone like to research. We all are doing research in different ways. It's just like the scientific. It's just carrying out in a scientific way. So I should say that just for a title, don't do it. You can always have a wide variety of career. But if you enjoy doing different things daily, you can always opt for research. That's it. I think I cleared your query.
Okay, that was a very nice answer,
Yeah.
especially to
Thanks.
my students. Okay, thank you. Now we are concluding. I am requesting Dr. Anisri, assistant professor in the department, to offer the formal vote of thanks.
Am I audible, sir? Sanjeev, sir?
Yes, you are audible.
Okay, thank you. Honorable Resource Person, Dr. Subina Raveendran, respected Principal, Dr. Sujay CP, all the teaching and non-teaching staff members of our college, my dear students and participants from other institutes. I would like to express my gratitude to all those who have been a part of our webinar on behalf of the Department of Physics at RSM SNDP College, Koilandi. Starting with the topic of today's webinar, the technology has taken over so much that we are able to live with all this biomedical implant artificial materials very normally. And I think this was really an interesting session for all the participants over here. At the outset, I would like to express my deepest sense of gratitude to our resource person, Dr. Subina Raveendran from Solar Panel Company, California. Dr. Subina has spared her valuable time from her very busy schedule for us for presenting in our webinar. Thank you so much, ma'am. We are very grateful for your presence, and I'm really I'm really happy that we could arrange a session on this biomedical implant materials, and we could invite Dr. Subina Raveendran over here for this seminar. Thank you, ma'am. Thank you so much. I'd like to express my gratitude to Dr. Sujay Sipi, our principal, who has been very encouraging to conduct all programs in our college. Thank you for your unflinching and enthusiastic support, sir. I'd like to extend my gratitude to the head of the department, Dr. Saji Vesui, for all his valuable suggestions and support. Next, we are very thankful to Dr. Vinny, Assistant Professor at the Department of Physics, who has delivered a very warm welcome address to all of us. Thank you, ma'am. Then I would like to express my gratitude to the webinar coordinator, Dr. Bhavya. Since we are working in the same department, I've seen how hard she has been working towards the success of this webinar beyond her comfort zone. Thank you very much, Dr. Bhavya. Also, we are very thankful to the coordinator of our college, Ms. Chandini PM, for her all valuable suggestions and support. Thank you so much, ma'am. Further, my deep sense of gratitude and appreciation goes to all the participants over here who have been live with us for the past 1 hour, around past 1 hour, even on this holiday. Thank you very much. Thank you, everyone.
Okay, thank you all, especially Subina, for your great participation. Thank you. The session is over.
Yeah. Thank you, sir. Thank you, Anushree. That was a pleasant, warm vote of thanks.
Thank you, ma'am.